all of these people kept saying, the only thing I did different is I took one of those COVID vaccines.
Then it makes you think of all the other vaccines people are getting horribly injured by, like the HPV vaccine. Horrible, horrible injuries.
We had people coming into our emergency room right from the vaccination center.
You'd won an award, the Physicians Award, just a few years before.
Actually, it was just a few months before.
A few months before you were then fired for doing your job well.
There's lots of healthcare workers like myself who have woken up. We're seeing it. People are hemorrhaging out of the medical system.
I'm going to be praying for you every day. I think this is one of those cases that is a true hallmark case, one that we need to be successful in order to enact the change that's needed to restore the trust in the system that we have all lost. I'm Nicole Shanahan. Welcome to Back to the People podcast, which highlights the growth of a movement uniting America, where our government is free from corporate capture and where we give voice back to the American public. Deb Conrad, thank you so much for joining me today on Back to the People podcast. You're not really a social media figure. In fact, much of what's gone on and brought you, great popularity in the medical freedom world isn't well known in the mainstream. I even wasn't aware of your case until it was sent to me. And the goal of this podcast is to make your name known, make this case known more broadly nationally, because what you experienced in Rochester Regional Health during the pandemic, it's still ongoing. Nothing has really changed. We are still living in the same hell of gaslighting of medical professionals that we were in 2021. And you have an active lawsuit right now against Rochester Regional Health. And it's a very, very important lawsuit. We want everybody to look into it because this is a lawsuit that's impacting your healthcare directly if you're in the United States. And your lawsuit is you brought it forward under the False Claims Act, which is really fascinating. But let's rewind. Let's tell people how you got there and why this case matters. So you were working as a physician assistant at Rochester Regional Health, and not just any physician assistant, as I understand it. You oversaw an entire staff of individuals, physician's assistants. You were loved. You'd won an award, the Physicians Award, in just a few years before.
Actually, it was just a few months before.
A few months before you were then fired for doing your job well. And the case that you're in is because of the fact that in 2021, you were responsible for training individuals within your network of hospitals on how to report vaccine adverse events. And that was your job, and you were doing it as you were trained to do it. And suddenly, one day, HR walks in while you were on shift and escorts you out and then fires you, claiming that you were over-reporting adverse events to the COVID-19 vaccine. So walk me through exactly how you were experiencing it. You were, top of your field, very successful, beloved at your institution, doing your job. Well, what were some of the first adverse reactions you saw come through the door, and how did you know to report them as such?
In December of 2020, that's when the first of the vaccines started rolling out in my community. And initially they were given to high-risk people like our nursing home and elderly residents, and then offered to the healthcare workers. So when you think about that patient population, that was a very vulnerable and generally more sick population, at least when it comes to the elderly population. So they certainly experienced a lot of some of the worst side effects that we saw. Related to things like falls after they had a vaccine. They would pass out and fall, hit their head, develop brain bleeds, strokes, acute mental status changes, heart attacks, sudden heart failure. I mean, the list just goes on and on. And the proximity to which they received the vaccine and then the onset of these symptoms often was within sometimes minutes to overnight when the family would find them the next morning to, hours later to days later. But one thing that was very common between all of these people was they or their family would tell you it's due to the vaccine because that was the only thing that they did different. Now, could there have been some cases that, this was just a coincidental thing? Sure. But it just seemed like it was awfully odd to me that all of these people kept saying, the only thing I did different is I took one of those COVID vaccines. So, the light started kind of coming on in my head, and I said, something's not right. Now, prior to that, mind you, we did not receive any education about any possible side effects or what to do if we saw them happening. So the vaccine adverse event reporting system was not something that we received any education on for the emergency use authorization of the vaccines and their release, nor remember for any vaccines really that we experienced or gave out in our career, because in our respective training, discussion of side effects to vaccines are just not something that's even discussed. We are basically told they are safe and effective and to memorize the childhood vaccine schedule, and that's it. And so it's ingrained in us from our training to never look at vaccines in any negative light. And obviously, I see this now. I see this kind of calculated plan, so to speak, when I look back on my career and my education. So I had, up to this point, never heard of the vaccine adverse event reporting system. And I assumed that my colleagues and other people in my leadership also didn't know. So that's when I kind of, as a leader myself, went to my respective colleagues in leadership and said, hey, guys, we need to be reporting these side effects we're seeing, because I did my own education. I went online and found the vaccine adverse event reporting system and read all about it and taught myself how to file reports. Nobody taught me. But then with that, I then went and volunteered to be the reporting liaison and the educator for our system because I didn't know. So how could anybody else have possibly known? So that's kind of how I came upon that and how everything started. And back to what you said on the very beginning, another thing that I want listeners to know is that also within that same year that I was fired, I was nominated by my New York State Society of Physician Assistants to sit on the board for professional misconduct for the
Wow.
state. So I was nominated to take a vacant seat with the New York State Board for Professional Misconduct. So, I was very well respected in my field and was very much involved in leadership in both the hospital and in my state society, representing physician assistants in my state. And up to this point, had not had any complaints about me or people who generally get nominated for things are it's because of their exemplary care, right? Not because they're doing bad things.
In what year did you look into the vaccine adverse event reporting system, VAERS? Because, as you said, doctors are not really trained in how to use it. Physicians' assistants aren't trained in how to use it. So you took it upon yourself to look into the details of it. And this is true across the country, right, Deb? It's not just localized to one hospital here and there. This is not a fringe reality. This is actually the mainstream reality across most hospitals, is there is no formal training in how to file VAERS incidents.
That is correct. And so I discovered this right at the time of the vaccine release, when I started getting patients coming in with these adverse reactions that they themselves said were happening. And I believed them. I believe my patients. I don't, think they're just making stuff up. They themselves knew something was wrong. This was the only thing they did different. And many of them, sometimes within minutes of the vaccine, started not feeling well. And it just gone on from there. So what else are we going to blame it on? That was the only thing they did. So that was when I first discovered the system that has been in place since 1990. You can imagine that's when it was enacted, came out of the 86 Vaccine Injury Compensation Act and all of that. And here I never heard of it. And I graduated PA school in 2003. And yet I had never filed a VAERS report in my career, knew about it. It's really, I mean, I'm embarrassed to say that, but really looking back on my training, and again, that whole mindset, I knew everything there is to know about side effects from drugs and what to do if a patient suffered an adverse reaction to a drug, but never to a vaccine. I mean, certainly I knew that, let's say, if somebody got a flu vaccine and then suffered Guillain-Barré, that would have been a vaccine side effect. But other than that, we're only ever told, oh, they're going to get a fever and a sore arm. Other than that, patients are going to be fine. And there was never any reference to adverse event reporting or any sort of systemic system that was designed for those reports, for which the CDC and the FDA then pull these things off the market if they're unsafe, right?
When you started filing your first few reports, did you start to suspect that this was going to be a problem for you? At what point did you realize this was going to create issues for you?
Pretty much immediately on so many levels, in the sense that to file a report and to do it well and include all of the information that they're asking of you is going to take about an hour of your time per report. And if you think about it, for a patient, that's something maybe that they could do because they certainly have all the information generally, with the exception of some things. But for a medical provider who's filing this report, you need the lot number. You need, the date of vaccine, who gave the vaccine, where they got it, all this information. Plus, you need medical chart information, and then be prepared if you, at the end of the report, list the patient as having not been recovered, having been hospitalized, anything that qualifies as a serious adverse event, which is anytime, like I reported them because they're in the hospital, right? You're going to get callbacks from the CDC. You're going to get emails from them requesting additional records. So you're now attached to this chart for the foreseeable future. It's a big responsibility. And the system is very clunky in that if you take too long on a page that you're on, there's like 5 different pages, it will time you out and then delete all of your information that you put in. Now, these are things that I had to learn via trial and error. And I have a lot of patience most of the times, right? But I don't think most people, to be honest with you, would have put up with what I did. But it just became so important to me to do this because I was seeing more and more people suffering these side effects and it adversely affecting them, that I really started getting worried for society. And it got to the point that I was doing so many reports in a week. It was so overwhelming for me because no one else had time to do it.
It's almost as if VAERS is designed for its obsolescence through like high friction, right? So it's designed to be obsolete because it's designed to be impossible to use.
Yeah, to deter you from doing it. I completely agree. At first, when I first started filing, I gave them the benefit of the doubt, right? But then I started saying to myself, this is the modern age, and this is pretty sad and embarrassing that our government system is this clunky, right? Like, who's in charge of this ridiculous monster? Obviously, whoever designed it is not a healthcare worker, because they would have realized we don't have the time, right? We just don't have the time. And but we want to get the information out there. We want to do our job, but it's almost as if it's purposely designed so that we don't give them the information and we just give up.
When did you file your first one, and how many were you able to file before they fired you?
I believe I filed my first one in January of 2021. In total, up to this date, I think I've probably filed, close to 300 reports. I certainly think I am the person in the country that has filed the most VAERS reports at this point. Really, I do believe I am. I do know that I successfully, while I was still employed, filed about 180 or so. which, if you can imagine, roughly an hour apiece. Now, some took longer because it timed me out. I had to go back. And many of them I had to send more medical records and talk to the patients, right? Because the patient's an active involvement here. They want this recorded in their medical record. They want copies of their report. They want their number. The other thing people need to realize is when you first file a VAERS report, you get a temporary number because the VAERS representatives, or whatever you want to call it, have to verify the report, meaning they have to look at the information and make sure that it's valid. It's not a lie, it's checked or whatever. And then they give you a permanent ID number that is a permanent record of that patient's injury. And so I would put that permanent ID number in the medical record, and I would call the patient to give it to them because that's the right thing to do, right? This is their injury. And if they decide they're going to file for compensation down the road, you need to have valid medical records and documentation of what happened. That's the way you should do it if you're a good medical provider.
How many of these cases that you filed have even progressed past the initial stage of filing with VAERS? Have any moved through the vaccine injury compensation program?
Yeah, they have, but none of them have received compensation, even those that were so well documented. I just cannot see how in the world they denied some of these people compensation. I'd love to know what their reasoning was. Because there was one particular patient who had so many medical providers document that they also felt it was due to the vaccine. And I documented a sound scientific reason why we felt it was likely plausible. It was a woman who developed type 1 diabetes in her late 60s. That is unheard of. She's probably like one of the first cases in history where it was autoimmune type 1 diabetes, admitted to the ICU on an insulin drip in diabetic ketoacidosis. Somebody should have been doing a research trial on this woman. I have never seen anything like this. And it was such a profound presentation, so unusual, that the ICU physicians involved in her care also said, hey, this seems like this could possibly be related. But yet they denied her in the compensation program after, dragging this poor woman through the ringer for years.
Unbelievable. What an insult to our justice system. What an insult to the medical profession. What an insult to Americans. I mean, it makes me sick. And you're the first person I've spoken to, Deb, who's been this close to reporting, who has really tried to figure out how to use our system to seek justice for this failed vaccine and this disastrous program and this horrific reality that we are all still living in today. Nothing has changed. Not one thing has changed. If anything, it's gotten worse. They're making examples of people like you. Who within your organization is then going to step into your shoes and say, I'm going to carry on Deb's work reporting these injuries? So
No one.
no one, not one person. And this is the signal they're sending, and it's a very effective signal. People are terrified to come forward and report. Let's try to extrapolate based on the data you've seen. Right. And I know you've probably met other people. I know the medical freedom community has a, silent whistleblower, informal relationship where, doctors like Mary Bowden get calls constantly from practitioners, who aren't ready to come forward publicly, but who are tipping her off. And, I get some of these tips too. So let's extrapolate the data. Based on what they're currently reporting as being vaccine injuries, what do you think the real number is? Of the millions of doses given, what percent do you think have resulted in some form of adverse reaction?
The answer is complicated because I believe that the emergency use authorized product was different than now the approved product. Based on what I saw, it seems like certain lot numbers of the emergency use product seemed to cause more side effects than other lot numbers. We had some patients, receive a couple of vaccines and they were fine with their first one, not with their second one, fine with the second one, not with the first, or you know what I mean? It was very strange. And so it was almost as if there was some sort of inconsistency amongst vials. So early on, when these vaccines first came out, I think the amount of, at least it's hard because I was working in a small hospital system. And honestly, nearly every patient that came in after having received a COVID vaccine at that time, there was suspicion on my end that that might have been a contributor to their hospitalized complaint in one way or another. So I would say all of them, right, that received a COVID vaccine at that time. Now, people who are receiving boosters and things like that, which there are so few, I am not seeing people coming in with those acute, unusual things. Now, I'm not being hospitalized, but in the small practice that I'm working at, I can't say that I'm seeing somebody get a booster and then pass out at the center and the ambulance get called and then they're headed to the ER, like I did with those first vaccines. On a previous podcast I was on, I spoke about one of the more common things we used to see in my small community in the local pharmacies is the ambulance being present at the pharmacy. I had never seen that in my career. And all of a sudden we were seeing ambulances parked in front of our pharmacies picking up people who were passing out from the COVID vaccine. And we had people coming into our emergency room right from the vaccination center, right? The only time before we ever saw that is if somebody like who received a childhood vaccine or something had true anaphylaxis or something and had to be brought in. This was a very common occurrence. So I guess to your question, I think what we see in the VAERS system based in 2021 and 2022 is unbelievably unreported. Those numbers have to be multiplied, I think, by tenfold, maybe even more. I don't even know. It's astronomical, I think, the amount of people that have been injured by those first emergency use vaccines.
Yeah. And, it is unclear what the differences are between that first batch and the irregularities in the lot numbers to what's on the market now and what was actually just approved for children, at-risk children, another mRNA, Moderna vaccine. Did you see differences between the Pfizer mRNA and the Moderna, or do you think it's the mRNA platform itself?
Honestly, I saw problems even with the Johnson & Johnson vaccine. So it makes me think that there's something with the spike protein as well, because the Johnson & Johnson I saw, the blood clotting issue, the stroke issue, the heart attack issue, which was, the warning that they put out then for the Johnson & Johnson vaccine. But it was difficult in my community because we didn't have all three vaccines available all at once. For a period of time, we had, say, the Moderna available. So it seemed like every patient coming in was a Moderna patient. And then we'd have the Pfizer in the community, and then we'd have Johnson & Johnson. We didn't really have all three available all at once.
Calling all curious minds. Thrill seekers, deep thinkers, debate lovers, story chasers. Those who question everything and those who just love a great read. At Skyhorse Publishing, everything is on the table. And we mean everything. We stand for free thought, bold ideas, and fearless storytelling. Whether it's uncovering the truth, teaching a new skill, or sparking inspiration, we publish books that matter. With 12,000 plus titles in print and 400 more on the way, Skyhorse is one of the most dynamic independent publishers. We challenge the status quo. We bring every perspective to the table, giving readers a place to explore, question, and grow. Want the truth behind the headlines? Read Rand Paul's Deception, The Great COVID Cover-Up. And pull back the curtain on power and public health with RFK Jr.'s The Real Anthony Fauci. Work hard, Move fast, have fun, and change lives for the better. That's the Skyhorse way. Go to skyhorsepublishing.com/BTP to learn more. Skyhorse Publishing. Get reading because the sky's the limit.
So your lawsuit's a really, really interesting one. It's the first of its kind. You're suing for retaliation, but that's not what makes this case unique. What makes this case unique is that the False Claims Act law suit that you're also bringing um, is very, very special, and you're doing very well in your case, as I understand it. Rochester Regional Health tried to move to dismiss it. The judge said no, this is valid, and he said it was valid because there's a requirement to report to VAERS these adverse events in an emergency situation. And if that requirement is not fulfilled, it's considered fraud for institutions that are receiving federal funds. So Rochester Regional Health was receiving federal funds during this entire COVID emergency period. And those funds were used for a plurality of emergency responses. The hospital had increased loads, very reasonable to receive federal funds for that reason. But tied to the receipt of those federal funds, and help me understand the nature of this law, but there is a requirement that failure to report can constitute potential fraud against the government.
Correct. Because each vaccination given was reimbursed by the taxpayers who, pay for these federal programs about $40, right? Each vaccine was reimbursed at about a rate, I think $40 or $44. But as a condition of that payment, under the emergency use, reporting to VAERS was a material condition of payment. The adverse reactions that were connected to this were your serious ones. And on the VAERS website, it clearly listed what is considered a serious adverse event. And inpatient hospitalization, COVID-19 infection requiring hospitalization, birth defects, myopericarditis, multisystem inflammatory disorder, and anything that falls in that category of an acute hospitalization or a hospitalization in general is considered a serious adverse event, as is like an emergency room visit or a miscarriage. Which, so, and it clearly stated that this is irregardless of causality. So the big thing that that was kind of coming in my direction and was argued with me throughout this process while I was employed was, well, Deb, how do you know this is due to the COVID vaccine? And I kept saying, it doesn't matter. It doesn't matter what I think. That's not my job. My job is just to report the information to the individuals whose responsibility it is to find those signals. I'm not saying it is or it isn't. I'm just reporting what I'm seeing and what the requirements are. But there was that, well, you're saying it caused it. I said, no, I'm not saying reporting to VAERS does not mean the vaccine caused the event. We know that. It says it on the website. We're just mandatory reporters, as we are in like child abuse situations, right? We're not there to judge who's abusing the child or determine that. That's not our job. And it's the same with VAERS. And no matter how many times I would show my leadership this information, the gaslighting just kept continuing. You're an anti-vaxxer. You need to toe the company line. And I'm like, no, that's not what we're supposed to be doing. Our first priority is safety. This is an emergency, a state of emergency. We have to stay vigilant because this is when mistakes get made, when everyone's panicked and fearful. So we need to stay rational and put our patients' safety first. That's what we do, right? And that's all I was doing. So yeah, it was very clear. And clearly whoever wrote up the program participation agreement for the COVID vaccines under the emergency use authorization knew this, because there is no such program participation agreement like it for any other vaccine that is FDA approved. This was the first vaccine we used under an emergency use, right? This is under this mRNA new platform. So whatever legal group wrote this participation agreement up knew what they were doing, right? And they linked it to this, requirement to report as a condition, as a material condition of payment. So this argument for the COVID vaccines is not necessarily an argument that we can use for the approved products. Because once the COVID vaccines became approved and no longer under emergency use, reporting to VAERS is now optional.
What?
Yeah. If you go on the website for VAERS, you will see there are two different reporting requirements now on the website. Those reporting requirements for the approved products and the reporting requirements for the emergency use products. The emergency use had the required reporting attached to it, but not the approved, because that's what all other vaccines are, right? There is no penalty for not reporting for any other vaccine. It says we should do it, but there's no requirement. So that's what makes this lawsuit so unique, is that this is specific to the emergency use experiment we were all under. And remember, even though these products were approved, I think Moderna was approved in February of 22, many patients did not receive that approved product. They received the emergency use product. They were told it was approved, but what went in their arm was the emergency use product. And that's easy to find because we know this by lot numbers. And in, let's say, NICIS, the New York State Immunization Registry, when I look up a patient in my office's COVID vaccine record, it says Comirnaty or Spikevax. So I know they received the actual approved product. If it doesn't have those brand names listed, I know they received the emergency use. And that's a required VAERS report.
Interesting.
Isn't it?
And you have standing to bring something under the False Claims Act. Do those injured have standing as well if there was a failure to report their injuries?
Absolutely. And I encourage, again, the poor they don't know either, right? They were not given any education about what to do with side effects. I mean, if we even get into that, what was that app that they put on their phone? I can't remember the name of the app that some patients were told to report adverse. Even that system was designed to not really quantify or be able to individually put in exactly what your side effect was. It was a sore arm and the usual. But if you had something major like a hospital stay, a heart attack, you couldn't put it in there. So the true information wasn't given. So for these patients, yes, I tell them, and I did tell many of them when I was still employed, those patients I couldn't report on because the hospital no longer allowed me to. I told them, go to the pharmacy that injected you. Go up to the counter and tell them, you gave this to me. I was hospitalized after. You need to file a VAERS report, and watch them laugh at you and then record them, right? Because I actually did this. I had a patient come into the hospital whom I was not allowed to report for because this, and we'll get into that, but I wasn't allowed to report his case. So he was vaccinated at a local pharmacy, and the pharmacist apparently thought they didn't give him the vaccine. They thought it squirted on the floor or something. So they gave him another dose, right? And then of course he had an arrhythmia and ended up in our hospital, young guy. And he had a heart arrhythmia from 2 doses of the vaccine. So I called the pharmacy because he told me he was just there. So the pharmacist, Don, was the one that gave it. And I called him and I said, look, you just injected this guy with 2 doses of the vaccine and he's now hospitalized. You need to file a VAERS report. And he laughed at me. And he said, what are you talking about? We don't file VAERS reports. We don't even keep records of this stuff. Like, this is what we're dealing with, right? This is what we're dealing with. It's embarrassing. It's disgusting. This is not medicine. We're experimenting on people and it's got to be stopped. It's wrong. because we're losing trust, right? People have lost trust in the medical system. They're losing trust in the vaccination program. And it's not people like me that's making people lose trust, right? Even though I'm the one that's being told, everyone's saying she's the anti-vaxxer causing everyone not to get vaccines. No, it's this lying that's going on, this lack of informed consent, this playing around with people's lives. That's what's causing people to lose faith. People know what's wrong with them. They knew how they felt before that vaccine. They know exactly the moment they felt ill. And again, to deny these people what they know is true is so horrific. And I have never seen that happen in my career. We never not believe the patient, right? Or gaslit them. We don't do that if somebody comes in and they take a drug and they say, oh, this drug is causing me to have muscle pain. And if it's a statin, we don't tell them, no, it's not. We take them off the drug, right? But when it comes to vaccines, we gaslight them. And it's just so horrific.
It's shocking to me. I guess it's not surprising. It's shocking because it's horrifying. But then it makes you think of all the other vaccines people are getting horribly injured by, like the HPV vaccine. Horrible, horrible injuries. MMR, which is, you can't really talk about that one, but people do still in silent circles. It's getting louder, thankfully. But then you realize that the VAERS reported incidents are so minuscule, almost non-existent compared to the entire pool of possible injuries individuals are experiencing. And I mean, I've talked to thousands of parents at this point about how they went to the pediatrician once, pediatrician ignored them, went again, brought the kid back in again, pediatrician ignored them, brought them in a third time, pediatrician finally paid attention. But there was never any VAERS reporting. None of it.
Because the pediatrician probably has no clue.
Well, they have no clue, and there's no penalty for failure to report.
Exactly.
And
there's
only
no penalty.
There's only a potential penalty, which you experienced, of reporting. So let's kind of go back into how they penalized you and why doctors are afraid to report. And until that changes, we have to be very suspicious because there will be zero accountability for any harm that comes to anyone receiving a vaccine. We're lucky that you can bring this False Claims Act under the emergency orders, but in everyday life, there's no accountability.
Correct. Yeah. So with me, like I said in the very beginning, when I started to educate myself and then educate my colleagues, my immediate leadership didn't really have a problem with it. They were like, Deb, go ahead. If you want to do this, feel free, educate people. So I put envelopes in our emergency room in our fast track, because that's where a lot of these people got captured, right? Because they came through the emergency room. And so many of the doctors and the nurse practitioners and the PAs and the nurses, the aides, if they identified a patient that met that criteria, they would slip their face sheet in the envelope for me, and I'd collect it once a week, and I'd file the reports as I went along. But again, because it became a full-time job, and I was doing this on my days off, and I'm a good person. I was doing this for the right reasons, but at the same time, you're not getting paid for this. This is on my own time, right? You're doing this just for the good of humanity, but then it gets exhausting and you start getting angry and you're saying, why am I the only one? So I kept going back to my leadership and I said, we need to come up with a plan. We need to come up with some sort of system in the hospital that allows us to file these reports so we all contribute. I'm just not the only one. And they kept, yeah, we'll get to it, blowing me off. And I just kept pushing. Because I just said, this is exhausting. So what happened was our chief medical officer then went to the system level and started talking to them about what was happening at my small community hospital. That's when the suppression started. Because at that point, what happened was they wanted to audit my VAERS reports. So instead of believing me and having a conversation with me, they did a silent audit of my VAERS report. So I picked patients that met the exact criteria on VAERS, the exact criteria, which the easiest ones were the patients being admitted for COVID infection who had been vaccinated, because that was required reporting. That's easy. And even with that, they came back and said, you're over-reporting. And basically, as a punishment, you can no longer report on any patients that come to your attention that you're not directly taking care of. And that's funny, right? Because as a hospitalist, I am responsible for every patient in the hospital, right? Because if somebody codes or goes down and they're not my patient directly, I don't just sit there. I run to that patient's room because the hospitalist oversees the care of all inpatients, no matter what. But they tried to reduce it to the fact that, well, they're not on your individual census, so you're not responsible for them. So I said to them, well, then who is responsible? And if I do get information about a patient that needs a report, how do I assure that it's done? And they basically did this, well, you have to put it in this Safe Connect system that we have through Rochester Regional Health, and we'll take care of it. I wasn't good with that. I said, okay, so do I get confirmation that it was taken care of? And they basically said, it's not your business, not for you to worry about. And I said, no, it is my business because you're committing fraud, right? This is a criminal, this is an issue, this is a criminal problem here. Like, you are billing for these vaccines, you are saying you are completing VAERS reports, and you're not. And if I know about it and I do nothing about it, then I'm just as guilty, right? So I wasn't having it. So at that point is when I contacted the FDA, the CDC, the New York State Department of Health, the New York State accrediting body, and I was just running in circles because nobody wanted to talk to me. So then I was able to secure legal help because this was getting ugly. And I knew my job was on the line. I knew I was in trouble because the gaslighting, the pulling me into meetings, the accusing me of being an anti-vaxxer, the accusing me of spreading vaccine misinformation, threatening to report me to my state society for potential license removal. I said, I need help. So fortunately, I was able to secure the Siri and Gilmstead law firm, of which Aaron Siri and Elizabeth Brem were attorneys. And they helped me while I was still employed and after I was terminated. They helped to write legal letters documenting what was going on, again, to the FDA, the CDC, the New York State Department of Health. So everyone was made aware of what was going on at my hospital and what was happening to me. And again, as things just kept going on, I then went public because no one was listening, nothing was happening, people were being harmed, and I couldn't sit by and just let it happen. So I went public on the high wire with Del Bigtree in September. I believe it was September 17th, I think it was September 17th. I went on the high wire and talked about what was going on.
Is that of 2021?
Yes, that was of 2021. And I also, at the time, was involved in a vaccine mandate lawsuit that was going on in New York State, and was trying to fight for the healthcare workers that were being forced to get COVID vaccines, of which I was one of them. I was working on a religious exemption that was approved, but the mandates were coming down the pipeline where our jobs were going to be threatened if we didn't ultimately submit. So I got very involved in the vaccine mandate lawsuits that were going on, and I went and did a piece, an interview with the New York Times around the very same time I did the interview with Del Bigtree. And then on October 6th of 2021, I believe it was less than 2 weeks later, I was surrounded at 1:00 in the afternoon, the middle of my shift, by HR representatives from Rochester Regional Health. I was brought into a room, interrogated about everything, why I went public. I had a GoFundMe account because I knew I was going to get fired for blowing the whistle. And they ultimately said, are you going to walk out quietly or are we going to walk you out? And I wasn't allowed to get my things. I still have stuff left at the hospital. Interestingly, I knew I was going to get fired, right? You know this is coming. And so I did a few days prior, I started gathering some of my things from the office. So I would at least be able to get most of my things out of there. And I was walked out. I was thrown out of the hospital. That day, I was canceled. My health insurance was canceled. I couldn't apply for unemployment. They even fought me in being able to get my benefit time off that they owed me. I had to repeatedly call and request for my benefit time off that they owed me. So yeah, it was pretty awful. And of course, they're saying that they fired me because I wouldn't get the vaccine, that's why they fired me. However, I was working on a valid and approved religious exemption. I had signed up for testing, and no one else who was in my position who had a valid approved religious exemption, they all got fired November 22nd and were able to complete their shift. I was the only one fired that day and the only one walked out halfway in my shift. So you tell me what I was fired for, right?
How's the lawsuit going, Deb?
So it's going really well. We survived two motions to dismiss, and we're in the process of discovery right now. And hopefully we will have an update around August 12th or 14th, because we'll be meeting with the magistrate judge and Judge Sinatra again to go over how the discovery process will proceed moving forward.
Wow. I mean, I'm going to be praying for you every day until we see some justice here, because I think this is one of those cases that is a true hallmark case, a really important precedent-setting case, one that we need to be successful in order to enact the change that's needed to restore the trust in the system that we have all lost. And that's all we want. People lodge slurs at us for pointing out injury, gaslight us, erase our entire backgrounds and history, rewrite the entire narrative of who we are as people prior to getting canceled. And the reality is they're only just doing themselves a disservice. I mean, Rochester Regional Health is doing itself a disservice. I think we need mass admission that these were false claims. These were criminal denials of individuals' injuries. We finally have a body of case law that allows us to bring criminal action. We've never had that before because of the 1986 Act. But because this was under emergency orders, we have this very, very unique body of laws. As far as you're aware, is this the only current lawsuit enacting the False Claims Act, or are there others out there?
This is the first one, and this is the first one in history under this theory. So it's wonderful, and it has to succeed because me as an individual, I have lost faith, right, in the system that I have been employed in, the medical system, right? If we're going to be fired and our careers destroyed because we're reporting safety issues to systems that are supposed to be there to protect us from harmful products, what are we, right? What exactly are we? And what is the VAERS system then for? I mean, why do we have it? If we're not going to allow the information to be put into the system, and we're not going to hold those accountable who suppress people like myself who are trying to just do their job. I'm not saying these vaccines have caused I don't know, right? That's not my job. Somebody who gets paid a lot more than I do and has a lot more power has that job. And they're clearly not doing it, right? They need to be replaced. We need a whole new overhaul of this system. It's embarrassing. We are the United States of America, and we should have the best health care, and we should put the safety of our citizens first. And if this system is broken, we need to fix it. It's a long time coming, in my opinion, because there's lots of healthcare workers like myself who have woken up, right? And we're going to lose our faith in our professions. We're seeing it, right? People are hemorrhaging out of the medical system. They are hemorrhaging. And we have long wait lines for specialists, and everyone's burnt out. It's just because the system is just so broken. And the vaccine system is falling apart, in my opinion. I'm seeing it in the parents of children who now are questioning all vaccines for their children. I mean, the Journal of the American Medical Association just did a piece talking about that, parents, for the first time in history, we've got a large amount of parents asking questions about vaccines. Why is that a big deal if they're so safe, right? If they're so safe, what is the problem with me reporting to VAERS? Why is there such suppression of people like me?
Well, and the reporting has the immediate effect of improving the safety of the vaccines. Without the
Right?
reporting, you'll just have bad information as to the real data and figures behind what kinds of reactions occur. One thing I learned was that if you have a flu or your kid has a flu, you have this 2-year-old kid, they have the flu, and you take them in for an MMR, the doctor's not supposed to administer the vaccine that day. But
Correct.
because all of these incidents are underreported, that isn't common knowledge, right? Parents don't know you're not supposed to take your kid in for a vaccine when they're sick. It creates a huge amount of risk. Um, Especially in the little ones, the ones under 5 years old. I mean, it's just wild to me. And the kinds of changes that we could just so easily and elegantly make in our system, they're making those changes in places like Japan. In Japan, they've pushed out the date, the age of children receiving childhood vaccines, and they've changed their schedule. And as a result, all kinds of i- chronic childhood developmental disorders are now plummeting in Japan because they're keeping track of it, because they're being honest about their reporting, because they're not censoring individuals like yourself and myself, like we are here, and it's institutional censorship here, and you get a lot less of that in Japan. And as a result, you get a healthier. It's immediate. It's incredible how fast these small changes make to the occurrence of developmental disorders in children. And we owe our country that. We owe each other that. We owe our families that. We owe the future of this nation that. We owe taxpayers that, because taxpayers are the ones that are going to have to take on this burden of caring for individuals that were injured as children. Our future is looking very dire right now with the number of developmentally challenged individuals there are. Our society cannot handle it.
You're absolutely correct. And then we've got these individuals who received the COVID vaccines in 21, and they only received, say the first two. And now in 2025, aren't they coming down with all sorts of strange things that are rendering them disabled, right? So now we've got a workforce that is impacted because people are sick. They are sick. This does not seem to be going away or getting better, even though we've stopped vaccinating for COVID, in the sense that many people have stopped taking boosters. Really, what these people who did take the first few are now developing conditions years later, or they're birthing children who have congenital birth defects that we are seeing. We're not thinking, that impact. And then again, like you said, we have our children receiving all of these vaccines as young babies. We've got all these, autoimmune issues and autism and Asperger's and developmental delays and all sorts of things that are going to impact the workforce. Our nation is in trouble on so many levels, right? Our insurance companies are in trouble. Our life insurance companies. I mean, it's really scary. And that, and then we've got all the other issues that America deals with: poverty and homelessness and addiction. And we get nowhere by, withholding information and lying to the American people for profit. You never win. You're not going to win.
It's disgusting. For all those people out there looking for relief from what they believe to be an adverse reaction, and some of these are, I mean, I've never heard the diabetes, type 1 diabetes in a elderly person. That's wild. But, in young people, we're seeing neurologic issues, gastric issues, all kinds of strange things. Who do you point people towards? What What resources are there out there if people can't trust their doctors to give them any advice or even acknowledge that perhaps maybe it has to do with a COVID-19 vaccine injury? Where are you sending people?
I usually, I will first point out React 19 for certain, because that is a great organization to help people feel validated, like they're not alone. Because that's one of the biggest things is, many of these people have been told over and over again, it's not the vaccine, you're crazy, you're crazy, making them feel like they're making this up. And React 19 will help them feel validated. Obviously, I also, refer them to some people and some healthcare individuals that are trying to find solutions for patients, like Dr. Peter McCullough, Dr. Pierre Corey, even Dr. Simone Gold and Gold Care. There are many providers across the nation that are trying to find solutions for these patients where our government is failing them. Because to my knowledge, I don't know where there's research being done in the federal government using taxpayer dollars to help us find solutions. I know under the last administration, there was a lot of money that went into trying to find some answers, and nothing was found for even long COVID, supposedly, but so it's really discouraging. And I am very discouraged as a healthcare provider because I myself am trying to find solutions for these people. Certainly I can treat whatever conditions they have with whatever we have at our but in order to prevent progression or prevent new things from going on down the pipeline, how do I fix it? I don't even know really what's wrong. Is it the spike protein? Is it the mRNA potential DNA integration? Is it the SB40's promoter sequence? Is it all of them? I don't know. Is it previous past COVID infections adding to the problem? There are so many possibilities that are of things that are possibly contributing to these individuals suffering.
Yeah, it breaks my heart. It continues to break my heart every time I think that we're turning a corner. It just seems like we've created an insurmountable, by we, these horrible people that push this
Mhm.
dangerous vaccine on us and are protecting the vaccine program while just, sweeping these the atrocities under the rug.
And by continuing to do that, we're just fostering continued and additional mistrust, right? We're making the problem worse, not better. What people want to see is an acknowledgement that the harm has been done and a solution. They want to see an actual solution being worked on for this broken, horrible system.
How can we support you, Deb? Because you're fighting the fight for all of us. We need this False Claims Act lawsuit to be successful. How can we support you?
So my attorney Warner Mendenhall and I have created a website called iamdebconrad.com, and there we have all of the legal filings on the website that people can read. We update the website as we go along in this journey of ours. There's also a donate button to our GoFundMe, because obviously raising lawsuits like this is extremely expensive. You know, people or this money doesn't just come out of nowhere. And I tell people, I'm not suing for myself. People have to understand a False Claims Act case. I am the relator for the government, so I am suing on behalf of the taxpayers of the government. So that any money awarded goes back to the government, to the taxpayers, right? Any fines that are given to Rochester Regional Health potentially in the end, that goes back to the government, not to me. So yes, I do have a false or a whistleblower lawsuit. That's like that's not what we're talking about here. That's some back pay and things like that. But I mean, that's not going to change policy, right? That's not my passion. My passion is to change policy, to change what the harm that's been done to both myself and also to my loved ones, your loved ones, people all over this United States. That's what I'm fighting for. It's never been about me, What happened was just so wrong, because if they can shut me up like this or attempt to for reporting safety, where does that leave us in the future if we let this stand? People have to ask themselves that. We cannot allow this to happen.
I've been watching these injury lawsuits all over the world, really, and they just fall one after the other. They fall, and not in our favor. And accountability just becomes this elusive, unreachable, hopeless pursuit. But this one is interesting because you are suing on behalf of all of us. You are standing up and saying there is a federal law. Taxpayers were denied a promise. And this is an absolute right as a taxpayer to bring this suit forward. And like, very interestingly, it will go back to the system, and every piece of it will make the system better and stronger. So, God bless you. Thank you so much. I am rooting for you. I'll be making a donation. And, I'm going to try to get this story out here, as I know many people in the medical freedom community, and even outside of the medical freedom community, people who have been injured, who want to see some form of accountability, but have been told there's nothing that can happen. Well, this is something that can. And it's relevant for all of us. So thank you, thank you, thank you.
Thank you so much, Nicole, for having me on.